All right, do you have sciatica? How do you tell if you have sciatica? That's a big question. It's something you're concerned about, and it would be great if we could avoid going to the doctor to do these simple, easy tests you can do at home. There's 2 tests that we're going to show you at the end of this video to tell if you have sciatica and if it's something you have to work on or pursue. Sciatica is a very common term. It's used multiple times for a lot of different things. Sometimes it's not accurate. Anything that goes down the leg or 1 or 2 legs is considered sciatica. It's a term that's been around forever. The Greeks used to call it ishcios, or from hip. We used to think sciatica was actually originating from the hip girdle. That's a previous thought. Now it's evolved to a little bit more of indication of something probably going on with the disc segment or something in the lower lumbar spine. The nerve roots are commonly affected with sciatica are the L4, L5, and S1 nerve roots that come off your lower back, okay? They provide sensory, motor, and pain fibers down into those areas. And it's kind of like when that sciatic nerve gets pinched by whatever is pinching it. It can be disc, it can be inflammation, it can be a bone spur. There's a few different things that can cause this problem. The disc is probably the highest. Over 75% of sciatica they feel is related to a disc herniation, bulge, something going on in that area. It's almost like when you think about a pinched nerve has got this flow through a nerve, flow that goes back and forth, and it's kind of like an electrical signal. When you get the pinch, almost think of it as that garden hose. As you step on that garden hose, it reduces the flow down. And when you reduce the flow of the nerve signals to the muscle, skin, and pain, it gets thrown off. It starts giving abnormal things. You'll feel tingling, sometimes you'll feel weakness. And those are the kind of things that occur with a true sciatica nerve root kind of presentation. That's what will occur. Sometimes it's constant, sometimes it's on and off, but all kind of in that area causing problems typically on one side, sometimes both sides of the lower extremities. Okay, so we talked about sciatica, a couple things about it. If you have any of these symptoms with your sciatica, and they're called red flags, you have to stop, drop what you're doing, and see a doctor. Or in certain cases, go right to the emergency room. Some of these things are progressive weakness. And this is something where you really you suddenly lose strength pretty rapidly over the course of a few hours or over the course of a few days. And I'm not just talking you just didn't go to the gym. I'm talking about weakness. Sometimes you get really off balance with it as well. You'll have like severe balance problems because of it, because the muscles down your leg are affected because that nerve, that sciatic nerve is being pinched and it's stopping it. It's not getting that signal and it's turning off. If it turns off too long in a case of nerve damage, sometimes it doesn't turn back on, even if the disc, bone spur, or something else is off of it and no longer pinching like that garden hose we talked about earlier. That electrical impulse is no longer going there, and that can be permanent damage. So you really want to make sure that's in the cases. Another case too is bowel and bladder changes. You can't have a bowel movement, you don't have the strength, so the nerves going to that area can't expel, they can't push and have a bowel movement. Or in cases of bladder, they can't hold it in. People that get incontinent, they start wetting their pants. And it comes at the same time as they develop the sciatica. Saddle anesthesia, you get numbness right around the butt and the groin area, right in the saddle. That's something that you want to seek help very quickly about. And in cases of concern about fever, something like an infection, or possibly something that's cancerous, like a tumor or something of that nature, those are red flags. Some, not all of them, but some of the big red flags you have to consider before you start playing around with testing yourself or trying to do some exercises. You got to seek help quickly. So don't forget about that. If you're safe with that, you can move to the next step. So some of the things that you experience when you have sciatica is numbness, shooting, tingling, pains radiating, typically in the back of the leg. It can extend all the way down to your foot. Most times it's on one side, but it can be felt on both sides. In cases of sciatica, most people get better. That's the good news within 6 to 8 weeks, sometimes upwards of 12 weeks. And generally about 90% of the people that experience it, it kind of goes away just with the passage of time. So that's the good news. The 10% that kind of linger are the ones that we want you to be aware of, and if it isn't getting better, to kind of seek some treatment. So we're going to talk about 2 tests. One is called the straight leg raise test, or Lasag's probably not pronouncing it right. The other test is called the Slump test. Slump test you can do alone. The straight leg test, you need someone to do it for you. You can have a spouse. It's a pretty simple test, but it tells us a little bit about whether you have sciatica, which is the key. We want to see what's our starting point. Is this related to something going on in my lower back that's off? Or am I getting these feelings from something else? Maybe from my hip, from some kind of internal problem, something else that's going on. So these are very simple tests. We're going to do two of them. We're going to demonstrate them right now. Okay, what we're going to show first is the straight leg raise test. Okay, basically the person is lying down on their back. You're going to take their leg. They're not helping you, just so you understand. It's completely done by the examiner, being me. I'm the one that's lifting the leg. So when we lift up, at around 30 degrees, we may not start noticing the same pain that they're having. They'll say, hey, that's the pain I call my sciatica. Because as you start moving up into this area, you may get hamstring, pulling, or tightness, or something else that they're experiencing. We want the same thing that they're complaining about or you're having trouble with. That's a sciatica. That's what's happening. And what's happening is we're putting tension on the nerve roots that are coming off the back. As we do that, we say, wow, that's getting, the person will say, hey, that's the pain I'm having, or you're feeling that as they're doing the test, or your spouse is doing the test, because you have to have someone do the test for you. What makes the test more sensitive is you're going to bring the foot back like that. And what happens, all the nerves that are coming down and around the foot, as you do that, it actually causes more tension on it, and then they become more sensitive. Once you get around, at this point, around 70 degrees, we start affecting other things. We might be developing some hip discomfort or limitations at the hip or other things. So really passively, I do all the lifting and lift up. Ooh, we're getting the same symptoms. That's the sciatica complaining about. Wow, I think we're onto something. Really, to confirm it, you can bring your foot back, and in some cases even turn it in and rotate it in like that, so their body crosses the midline a little bit. All those things make the test a little bit more sensitive. So that's a straight leg raise test. Thanks. Okay, so our second test is called the Slump test. You basically have the person, yourself, and you're going to essentially have them slump down. So they're slumping down like so. They're going to let their head go forward, and they're going to straighten out their knee. Okay? So as we do that, we typically do, if they're having right-sided pain, and we'll start with the leg that's bothering them. They have sciatica. It's basically going to come up like so. You're going to give them a little pressure across your neck, or you can do this yourself. Just push yourself a little further forward and bring your foot back. That will sensitize, just like the straight leg raise. Sometimes they'll say, oh, I feel the symptoms. Oh, it gets worse like that. And then you have them sit up and it goes away. So we're going to do that test one more time. So we're going to have them slump down, let your head fall forward. Let's bring your leg up, a little bit of pressure, and a little pressure down. Oh, I can feel the sciatica. Then what we have is we have them sit up or stand up a little taller. Bring your head up like you're looking forward. Wow, the pain in my leg goes away. It's a whole neuro tract or neurological tract that we're talking about. And by slumping forward, we put those nerve roots on tension. Therefore, if there's a disc herniation or something affected, maybe not herniation, but something along the track, it'll give the same symptoms that they're complaining about. They'll complain about other things too. Sometimes they'll have pain. You may have other types of pain, but not the pain that you're coming here for. Listen, I hope this video helps you out. If you have sciatica, it's something that may go away with a little bit of time. But at a certain point, around 6 to 8 weeks, we probably want to make a decision where we're going to get a physical therapist evaluation and decide what can we do to maybe help us move along so we don't get into a plateau. Listen, I hope this helps you out. Subscribe if you like this. Place a comment as well. Or forward to a friend that might be concerned about this. Okay, hope to help you out. Have a great day.